Hello, welcome to this whole life action hour. I'm Nichole Dandrea-Russert, Food Revolution's lead dietitian, and today we will be exploring natural ways to support women's health and common issues affecting women's health. Lifestyle choices contribute to a staggering 80% of the ailments doctors see in their practices, but the power to pivot to better health is within our grasp. Today, we are going to delve into the transformative world of lifestyle medicine with Dr. Nitu Bajekal, a pioneering gynecologist at the forefront of this movement. This action hour will illuminate how a whole food, plant-based diet can support women's health and reduce the risk of common lifestyle diseases. From broader concerns like type 2 diabetes, heart disease, and cancer, to concerns specific to women's health like menopause, PCOS, and various reproductive cancers, we hope that through today's interview, you will be equipped with the knowledge to your healthiest self. It is time to get proactive and dive deep into the science of well-being. So to give you a little context, this is a project of Whole Life Club, which is Food Revolution Network's ongoing membership community. Some of the questions that I will be bringing to this interview today come from our Whole Life Club members. Nothing you hear is medical advice. We are offering coaching and our own best insights. So always consult with a qualified healthcare professional regarding your specific healthcare realities and needs. So to introduce you to the wonderful Dr. Nitu Bajekal, she is a distinguished gynecologist with over 35 years of clinical experience, blending traditional women's health with innovative lifestyle medicine in the treatment, reversal, and prevention of several chronic diseases. As one of the first U.S. board-certified lifestyle medicine physicians in the U.K., she authored the Women's Health module for the pioneering plant-based nutrition course at a U.K. university. Beyond the clinic, Dr. Bajekal founded Women for Women's Health in 2014, a voluntary initiative championing the empowerment of women of all ages to make lifestyle choices to improve their own health and that of their loved ones through education. Dr. Bajekal, welcome. Thank you so much for being here today.
Thank you, Nichole. It's such a pleasure. And I'm really excited to sort of dive deep into women's health and all the benefits that nutrition and a whole food plant-based diet can afford.
Well, I know we have a lot of folks who've been really looking forward to this. So I cannot wait to dive into the conversation myself with you. So thank you again for being here. I'd love to start with a very hot topic of late, which is hormonal imbalances. I feel like we're seeing so many questions and so many potential, ways to cure or help to alleviate hormonal symptoms. And I'd love for you to kind of either debunk the myths or let us know what you have found in your approach, maybe starting with a whole food plant-based diet and how that diet, whole food plant-based diet, can help to balance hormones.
Thank you. That's a great question, Nichole. Before I dive into what a whole food plant-based diet is and how it can help, I just want to explain what hormones are, because we talk a lot about hormones and hormonal balance and imbalance. And hormones are chemical messengers. And most hormones tend to be produced by glands or organs in one part of the body. So, example, your thyroid, for example, or your ovaries. And they exert their action in a different part of the body. So this is the beauty about it. They are very clever little chemical messengers that work their magic in functioning of the body. And so you have your brain sending messages through certain hormones via the pituitary gland and the hypothalamus gland to the ovaries, which are, situated deep in the pelvis, and then release estrogen and testosterone and progesterone hormones. So it's important to understand that without hormones, we can't actually be alive. And there are several glands, and we've heard about the adrenal glands producing cortisol, which is also important for hormonal health. There's another term that I do want to sort of debunk a bit, which is hormonal imbalance. We don't like using the words hormonal imbalance in the medical world because really the body does a very good job of producing the hormones. It just means that in certain situations, some of the hormones, the way they work, they're not doing their best. So rather than them being imbalanced and trying to put it back into balance, because you do hear a lot of and doubtful experts who are not medically qualified saying, take this medication or take this, and you can actually then balance your imbalanced hormones. So I just wanted to clarify that hormones are chemical messengers produced by our body, and we ideally like to stay away from terms like hormonal imbalance. So what happens is that women's health, or anybody who identifies as a woman who's assigned female at birth, when I use the word woman or women, I mean that. Hormones play a big role from the time the switch is turned on, which is the start of puberty, when usually young girls will notice the start of signs of puberty around anywhere from after the age of 8, usually around the age of 12 or so, where there will be breast buds and axillary or pubic hair, and then a couple of years later their periods will start. And the first time you start a period is known as a menarche, which is a Latin word. And throughout, from the time one starts periods until the time they stop, which is menopause, we have hormones that play an intricate and complex role in the health of our reproductive system, of the health of our overall body, as well as, of course, infertility and things. And so what I want to, and there are many, so the human body is wonderful, and it helps, us do all these wonderful things, but sometimes it doesn't get everything right. And part of that is to do with the environment we are in and the foods that we eat and the lifestyle that we lead. And so we do know that certain conditions, if you especially have got the genetic tendency to get a particular condition, what can happen is that gets amplified with the kind of environment you're in. And sometimes you can't always choose the kind of food you're eating, and you can't always choose the lifestyle, because it depends how you're born, the socioeconomic status. But we do know that those who have access can make changes, because the current food system and environment that we live in is quite worrying, and is responsible for quite a number of conditions that can actually improve, whether it is type 2 diabetes or heart disease or women's health. So women's health itself, there's not a single condition in women's health, whether it is managing heavy periods or painful periods or fertility issues or endometriosis or polycystic ovary syndrome or menopause or many of the reproductive type cancers, that will not benefit with a whole food plant-based diet, or a diet that is predominantly plant-based. So, and here again, I want to make a slight difference, a distinction between vegan, vegetarian, and plant-based diets, because when we say vegan, it's more of a ethical philosophy, and it tells you what the person doesn't eat. They don't eat animal products as far as possible, and they also don't use basically avoid exploitation of animals. That's what being a vegan is. A vegetarian is somebody who usually has dairy products. Sometimes they may have eggs, and sometimes they may have fish, depending upon, there's a very broad classification. But a whole food plant-based diet, or a plant exclusive diet, it tells you what the person is actually eating. And we know that that if we actually fill our plate with whole plant foods, we tend to see improvements in hormone levels and generally benefits for a lot of conditions that we as I've been a gynecologist for nearly 40 years now. And, there are a lot of conditions which can really improve when you look at what is going on to your plate. So a whole food plant-based diet involves eating mostly whole plant foods or minimally processed plant foods. And so your plate should really be, or your diet should really include foods like lots of beans, lentils, they come under the group of legumes, and they are very rich in fiber, and fiber is very important for hormonal health, and I'll explain in a minute. So you have certain groups of foods that you want to focus on particularly. So a group of foods like legumes, which are beans, lentils, and peas, and soybean comes under that. Then you have the whole grains, which are ideally intact or minimally processed. So you're looking at things like brown rice, red rice, wild rice, quinoa, millet, amaranth, things like that, so that you're eating them as close to their natural state as possible. But some processing is needed to remove the husk and things like that. So, not all processing is bad. And then you have the next, where you want to bring in vegetables, and a particular focus of all colorful vegetables and green leafy vegetables, which are very good for arterial health as well as for hormonal health, and reducing, fighting all the the oxidative stress that damages ovaries and our blood vessels. And then you have fruits, and people often are very scared. My patients will say, can I really eat fruit? It's got so much sugar. Well, there's a difference between having fruit juices versus eating the whole fruit, because a whole fruit comes packed with fiber. Now, in the UK and even in the US, the average woman will eat about 16 to 18 grams of fiber, when our ancestors were eating anywhere between 70 to 100 grams of fiber in a day. So we know that when you adopt a whole food plant-based diet, you will start bringing in a lot of fiber without trying very hard at all. And sometimes it can be quite difficult for people who have a standard American diet, because that is quite fiber deficient. So suddenly they'll start having bloating and things. So there are ways of trying to make sure that you start slow, start low, and slowly build it up over months. So you have the legumes, which one should be eating, which are the beans and peas and lentils. Then you have the whole grains, which should be the intact or minimally processed, the vegetables, and with a focus on green leafy vegetables, fruits as well, herbs and spices, making water ideally the drink of choice, and then also bringing in things like tubers, so potatoes, sweet potatoes, ideally, with the skin. They just get a bad press, but they're actually very satiating, full of fiber, lots of vitamins and minerals. So it's quite important to include these as well. And mushrooms, although the American College of Lifestyle Medicine doesn't really bring these into their definition, I would say that it's important to bring in this as well. So you're trying to eat as far as possible a whole food plant-based diet, and occasionally having a treat. Again, my patients will say, Dr. Bajekal, I was really naughty. I had a piece of chocolate cake. Well, that's why it's called a treat. You're allowed to have treats. What you don't want to do is, have chocolate cake for breakfast, lunch, and dinner. And so when you're eating a plant predominant diet, you're trying to eat mostly whole plant foods, but there are some people who can't do or don't want to do a completely plant exclusive whole food plant-based diet. So then at least trying your best and slowly working towards a plant exclusive diet can make a difference to hormonal health. And when I mean hormonal health, what happens is when you eat foods that are highly processed, ultra processed, or they are, fried, deep fried, high in saturated fat, which comes from animal foods, barbecued foods, all these contain advanced glycation end products. Advanced glycation end products, or AGEs, are glycotoxins, which basically they tend to damage the arterial tissues, damage the arteries or blood vessels. They tend to damage our tissues, and specifically they can damage ovaries. We know that in conditions like polycystic ovary syndrome, women are particularly susceptible to these ultra processed foods, and the ovaries can get damaged in that situation. So, there are many ways in which you can actually hurt your health, and many ways in which you can help your hormonal health with the help of sleep and exercise and reducing stress and avoiding alcohol and avoiding or not smoking, but also really trying to bring color onto the plate. So avoiding, not thinking too much of what foods are bad. I don't like to label foods good or bad. I always say, think of what you would rather put in your mouth or what you'd rather put on your plate. Just crowd the other foods out and inch your way up to a nice whole food plant-based way of eating.
I love that philosophy, and it reframes the mindset. Just it was more about abundance. It's not. If there's a negative association when you have to restrict, it feels
you
painful.
want it more. So,
Right.
if you have slipped up and had a packet of biscuits, that's fine. Don't blame yourself for it. Right. All you do is you pick yourself up and make sure that because once you start eating these delicious foods, you're going to start missing them. And I can promise you, most people, after some time, you'll find that the foods that you thought, you really enjoyed, you don't want to really look at them. But what I tend to always do is meet my patients where they are at. And I would tell your audience as well. So if you're somebody who eats one fruit a day, don't suddenly start trying to eat 10 to 13 portions that are recommended by the Canadian guidelines and the Japanese guidelines. What you want to be doing is, if you are eating one fruit a day, try to bring in a second fruit. Then try to bring it after a week or two. Find a fruit. I always say, are there any fruits you like? And they'd say, oh, I don't like fruits. Oh, but I do like satsumas or clementines. Okay, maybe you can eat a couple a day. And then, do you like grapes? And then do you like mangoes? And then do you like bananas? And you slowly build that up on the fruit side of things. Same things with the vegetables. I often have teenagers and the mother will say they don't eat any vegetables. And they say, oh, but I like carrots. Okay, well, start with carrots and then you add some peas and then it's also how you cook it. And you have all these wonderful cuisines. So it's really meeting the person where they're at rather than having this prescriptive way that there's only one way. And if you don't do it this way, you're a failure. That, I think, leads to women already are harsh on themselves because society makes women really feel that they're always having to catch up. They're either like, I don't know if you saw the movie Barbie, where America Ferrera has this monologue where she says that you can't be too thin, you can't be too, there's a lot of pressure on by society on women. So I want women to take away, and men who are listening, because there's a diet culture nowadays. So I just want you to be kind to yourself. And when you do that, you'll find that stress levels drop, cortisol levels drop, hormonal health improves.
Right. It's also related. And yes, that monologue in Barbie was epic. I just wanted to play it on repeat. It was so good.
Yes.
And I also love what you mentioned, starting with what you know and love, because again, going back to the mindset, it's encouraging. I think it can feel defeating for people when they're like, but I don't like any vegetables. And like, where do I start? It's so overwhelming. There's so many to choose from, which is a good thing. But when just starting with what you know and love, it encourages you. You're like, oh yes, I do like this. And you feel good after you eat them. Correct. So it just helps you on to the next step. So slow progress is good progress. Thank you for all of that. And also thank you for explaining why hormonal imbalance is not really an accepted term in the medical field. That's really good to know, because I feel like it's used so often, health bloggers
and women go around feeling, oh my God, my hormones are not in balance, and as a result I have to do this and that and the other, when actually what we need is to look at have a holistic view, and also not and what I'm very clear about is not one or the other. I'm a practicing medical practitioner, so I'm very clear that there's always a role for medications and surgery for those who need it, but lifestyle and diet has to go hand in hand as far as possible. But it doesn't mean that you are a failure because you need to have insulin or medications for your type 2 diabetes, or whether you need hormone replacement therapy because you're menopausal and you're struggling with your symptoms, or you need fertility treatment. It is not one or the other, and that is so important. But yes, I think as doctors, we do our patients a disservice by not explaining the power of food, the power of lifestyle, and the power of actually being in control oneself, because we tend to often hand that control over to a third person. And the truth is, I'm never going to be as invested in your care as you are going to be invested in your own body and your own health.
Right. Yeah. You mentioned fertility. I'd like to discuss the role of whole food plant-based diet and fertility, as well as supporting fertility and a healthy pregnancy. Can you speak to that, please?
Yeah, because there's always been this fear that, if you're trying to get pregnant, if you are pregnant, or if you are breast or chest feeding, that, eating a plant-based diet is unhealthy for you because you have to supplement. Well, the truth is, any diet that is good for you needs planning. Right? And so when people say, oh, you've got to plan for this, oh, you have to take B12. Yes, somebody who's trying to conceive definitely needs to be, if you have the ability to, you should be trying to plan at least 3 to 6 months before.
Mm.
so that you're looking at the amount of caffeine you're having, because we know that high levels of caffeine can have impacts on pregnancy. And so you do want to make sure that you're not somebody who's drinking, 10 cups of coffee, one or two, if, early in the day, so that your sleep is not disturbed. It's fine when you're trying, but, ideally you want to keep it really low, especially when you're pregnant.
Mm.
So you also want to be taking a good prenatal supplement, which has got, B12 and vitamin D and iron and all the other essential micronutrients that you may not sometimes get from a diet. And this is not just for those on a plant-based diet. This is for anybody. You also want to be looking at things like omega-3. And so you want to be making sure that you're not relying on B12 from your food sources, because, you can have permanent neurological issues. Iodine is also very important, and you want to be taking 150 to 160 micrograms. I'm not a nutritionist, my daughter Rohini is, but, I am a lifestyle medicine physician, as well as have been an obstetrician for many years. So it's very important to know that, there is this thing that you can't do this, and you have to only eat animal products for pregnancy. And that is not necessarily true at all. And all dietetic associations all over the world now confirm that you can actually be very healthy and have a very healthy pregnancy with reduced risks of high blood pressure, preeclampsia, diabetes, gestational diabetes, and things like that. So getting ready for pregnancy also involves things like looking at how much alcohol you're drinking, and are you smoking. So there is help available. I'm sure help is available in the US as well, where because you do need some people do need that help to quit, whether it's drugs, whether it is cigarette smokes, whether it is vaping, whether it is alcohol. People sometimes do need support. So, and they also may not be aware. They don't realize that the safest amount of alcohol when you're trying to conceive and in pregnancy, and for anybody actually, is 0. So there's no safe limit for alcohol. You really want to be somebody who's, keeping away from alcohol because of the side effects that can occur, even with very small doses. And of course, we know on higher doses, babies can be affected with fetal alcohol syndrome. So you want to make sure that you're getting all the micronutrients and the important minerals and vitamins with the help of a prenatal, as well as a very varied whole food plant-based way of eating, or at least a plant predominant diet. And that's important. At the same time, looking at stress levels, understanding what is important, because the most important predictor for fertility is, of course, age. And after 35, and certainly after 37, women will start noticing quite a rapid decline in fertility, because you're born with the number of eggs. You don't make new eggs. And so you're born with, several hundreds of thousands of eggs, which will keep getting lost very rapidly by the time you reach puberty. And then by the time you reach 37, they dwindle down to, a few thousand. And so it's important to know that you don't need, you just need one egg, to get pregnant. But age is the most important factor, but lifestyle also is. So smoking and things can affect the quality of your eggs as well. And conditions that can be coexisting, like polycystic ovary syndrome or endometriosis, can make it harder for women to conceive. So if you're somebody who has heavy periods, painful periods, you should not just accept it as such, and you should request a pelvic ultrasound scan and a blood test to check, to make sure that you do not have conditions that can affect fertility, because most young women will get pregnant within a few months of trying. And so if you're somebody who's taking longer, or if you're above the age of 35, you don't want to be waiting for the year and a half that often women are told that they must wait. And, ensuring that, are you having painful sex? These are all important questions to be asked. And so we discuss all this in my first book, Living PCOS Free, where it's, I talk about hormonal health in great detail and how you can help yourself with diet and lifestyle. So pregnancy itself, again, is a very stressful time. You get a lot of advice from people that is unsolicited. And so you start thinking, what's going to happen? Is my baby going to get enough calcium? Is my baby going? So it's really important to work with, if you're plant-based, and if you are somebody who wants a healthy pregnancy, whether you're plant-based or not, it's quite useful to work with a dietitian or a nutritionist who actually knows what they're doing, because sometimes it can feel very overwhelming, especially when your family may not be eating the same way as you. So I think this is important to know, and also to be very reassured in the fact that babies are absolutely healthy, and in fact mothers can have much lower risk of complications that affect people who eat standard Western diets. And of course, women who tend to eat a whole food plant-based diet tend also not to be carrying excess weight as much. So, just being overweight, medically obese or medically overweight comes with a whole lot of risks in pregnancy, and also difficulty in getting pregnant and miscarriages and things. But of course, there's a lot we don't know, but age is important. So anybody who's listening, who's got young daughters and things, it's important to have these conversations. Even if they may choose not to have children later, they should know about fertility preserving options, whether it's egg freezing, embryo freezing. All these things are important discussions to have, because once you have that knowledge, you can then say, right, I don't want to do that. But if you don't know, you're going to then reach the age of 37, 40, because you're seeing all these celebrities having babies at 40, 45, and you don't realize that it's because of, donor egg or surrogacy or whatever. So you do need to educate yourself, and you'll be surprised. I have educated women coming in, and they have no idea that, age is the biggest factor to affect their fertility, and they think they have a lot of time.
Right, right. I think, yeah, moving into your 40s, you still feel like you're in your 30s a lot, so
Yeah,
you think like I
but
still
your
have
ovaries
time
are
to
not
think
thinking
about.
that.
Yeah, there's right. The ovaries are thinking a different story. Yes,
Correct.
exactly. Especially with
Correct.
careers now, because women are
Yes.
balancing careers, and it's like they may
Correct.
not be ready in their 30s to plan
Yeah.
for a family.
Yes.
So it is so important to know,
Yeah.
to be equipped with that knowledge. So thank you for reminding us about that. Moving into menopause, the next stage of a woman's life.
Yes. Each
Um,
of these topics are, they can be, I can talk about these topics for 5 hours on each of them. There's so much to talk about. So hopefully people get a
so
little
much.
snapshot, and they can
Yes.
go onto my website and read in more, they can delve into detail. Uh, I have fact sheets on most of the conditions. So hopefully they'll
We
find that helpful.
we will definitely link your
Yeah.
website and your books. I'm
Yeah.
sure you'll see like an
The
uptick in your
website
books
is
after
all
this.
free. The website is all
Wonderful.
free. So anybody can read it, and you don't have to spend money to buy a book or anything.
Oh, thank you. I'm sure many folks would love to read your book and dive deeper. And we have a very hungry, literally hungry, and hungry for more knowledge group. And they're
Good. Well,
probably
my next book is coming out in April as well on menopause. So
Oh, okay, buying that. Um, thank you for letting us know that. That's great. Well, yeah, and that leads us into the topic of menopause. So, it is a transition I feel that is dreaded by a lot of women. Me personally, I'm trying to embrace it and celebrate it. And again, the mindset thing is, I think, is so important in so many stages of a woman's life. So, I'm trying to embrace the different things, the mood changes and all with a smile.
yes,
And I know a lot of women experience a lot of different things. So sleep disruptions, hot flashes, mood swings, weight gain. There's so many symptoms of menopause. How can a plant-based diet help to mitigate some of those symptoms?
yeah. So I have a personal interest in this because I became menopausal at the age of 38. I thought I
Mm,
was just being stressed. This is a gynecologist, a consultant gynecologist who wasn't willing to face up to the truth. But
mm,
when you stop your periods under the age of 40, it's known as premature ovarian insufficiency. And for that group of women, hormone replacement therapy or menopausal hormone therapy is a must. Okay, unless there's a medical contraindication, one is meant to have it. And sadly, in my situation, because of the WHI trial in those days, my doctors weren't prepared to give a gynecologist the medications that she was asking. So, but luckily for me at that point of time, 22 years ago, my younger daughter, who was about 9 or 10, went vegan. And so I thought, okay, let's see what this is, because I'm not going to let her do anything on her own. And I became vegan too. And I have to say, within a few months of changing my diet, I found so many benefits, but I still did not. The scientist in me, the skeptic in me, I didn't realize, I had no idea about nutrition being related to how I felt. I knew that from my parents, having looked at, they basically ate a whole food plant-based diet in India. And but still, I did not realize that the reason I was feeling so much better and my hot flashes had improved and things was because of what I was doing. Because I was always physically active. I was never overweight. So I was okay in all those other aspects. So it was the diet that had made the difference, but it took me another 10 years to click on after I'd done all my research and then retrained as well as a lifestyle medicine doctor. So menopause is a retrospective diagnosis. It takes 12 months of not having a period when the eggs in your ovaries drop to a critical level and periods completely stop. So menarche is the start and menopause is the end. But there is a 2 to 8 year lead up to menopause, which is menopause transition or perimenopause. And this is a time when women may even not have started their families. So if you're destined, so menopause occurs between the ages of 45 and 55. And if perimenopause starts, say, 8 years before that, you're hardly 37, 38, and you may not even have thought of starting a family. That is why it's so important, because you don't know what the future holds. These are all retrospective, looking back and saying, oh, yes, that was perimenopause, and now I am menopausal. So it is important that people are aware, because you might be at the peak of your career, you're trying to really reach the top, and you're having all these mood swings and hot flashes, and you think you're going crazy for a few months, and then your periods hop and skip and they get crowded, and then everything goes back to being normal again, and thinking, oh God, did I imagine all that? And so it's so important to be aware that that's what perimenopause is about, and also understanding that there is help available, both medical help in the form of hormone replacement therapy for those who need it, but also diet and lifestyle. And a whole food plant-based diet is particularly helpful with a focus on beans and a focus on legumes. So beans and peas and lentils, especially soy. So people are often scared of soy, even in the plant-based community, but soy is it's a magic bean. It has lots of fiber, great source of plant protein. It has got all the plant estrogens that you want. And the same plant estrogens are there in blueberries and pistachios and in flaxseed, but nothing compares to the soybean. So you really want to, and it's never too early to start getting ready for hormonal health and menopause as well. So you want to, and it's never too late. So if somebody is 60 and listening to this, or is 70 and listening to this, or 90 and listening to this, or 25, you can start eating a plant-based, whole food plant-based diet, and it will benefit you for improving your health at whatever stage of life it is. So with a whole food plant-based diet, there have been nice studies, but essentially the soybean, you want to be having about 40 to 50 milligrams of isoflavones, which are the plant estrogens. And so you want to try and get that from a large handful of tofu, a large handful of edamame beans, which are the young soybeans. You can also have a cup of soy milk, some tempeh. You want to be having foods about 2 to 4 portions of soy every single day, because that you don't want to have more than that, because then you'll displace all the beautiful fruits and vegetables and potatoes and red rice and all the other mushrooms and things. So you want to be eating plenty of good plant protein in the form of tofu and things. But you don't want to be having 20 portions unless, that's you're working out to such an extent. But generally, I would never advise anybody to go higher than that. You can't actually, there are no side effects with eating, plant estrogens. So because they're there in chickpeas and kidney beans and all that. And what they tend to do is they reduce the risk of breast cancer, liver cancer, colorectal cancer, prostate cancer. We know that men, for example, who consume dairy products have a 25% increased risk of aggressive prostate cancer. When they switch it to soy, they have a 20% reduction in the risk of developing prostate cancer. So you can imagine that there are so many health benefits because of the way soy acts. The soybean is anti-angiogenic, which means it actually blocks the blood vessels which promote cancer growth. It also has a lot of fiber, so it will help to synthesize the certain bacteria called estrobolome in our gut, the gut microbiome, which is specific for hormonal health. Actually, soy and whole food plant-based diets are very good for that. So it reduces your risk of breast cancer, also by helping you to lose weight, because in the body fat is high levels of mammalian estrogen, which is the reason why animal meat and animal fluids like dairy tend to be higher in mammalian estrogen, which then stimulate breast growth and breast cancer risks. And so we know that eating plant estrogens, whether it is flaxseed, but you shouldn't be eating flax seeds in their whole form. You want to have it milled or ground. So a couple of tablespoons of flaxseed powder will give you the lignans or the other type of plant estrogens, which will help with hot flashes, but will also help with reducing your breast cancer risk. And soy, of course, will help in promoting bone health. We know that osteoporosis as well as improving your bone strength. There have been nice studies from the UK which have shown that eating soybeans can actually help. So I want people to try and eat a very wide and varied diet, which is basically focusing on plant-based. So big bowls of, dal or a kidney bean curry or minestrone soup with beans and things in it. A morning breakfast should be a large bowl of porridge with a couple of tablespoons of flaxseed powder, a tablespoon of maybe almond butter, a cup of berries into it in soy milk, so that you have all the soluble fiber, the omega-3s, all the with a teaspoon of cinnamon powder, so that you can regulate your blood sugars as well. So you want to start your day like that. I have a whole menopause menu on my website, which allows people to actually understand. And I've got lots of recipes as well. People say, oh, I don't like tofu. Well, try my tofu scramble. You're never going to dislike tofu again. So I think it's just being experimental, understanding, trying out different things, bringing in one new food at a time, making sure that your beans are cooked really well, really soft, so that you don't get bloating, starting to have small amounts. If you're somebody who's never eaten beans, how can you eat a bowl of dal or a whole bowl of beans? So what you do is you start with a small teaspoon, then a tablespoon, and you slowly build it up and start with the smaller legumes. So lentils tend to be easier for digestion than beans. So it's just understanding that. But studies have shown that even a half a cup of mature soybeans, Dr. Neil Barnard did a wonderful study which showed that there was an 84% reduction in hot flashes when women consumed it for just 12 weeks. So that's really important. Same thing we know with painful periods and heavy periods, with endometriosis, with polycystic ovary syndrome. We know that in endometriosis, those who eat even a portion of red meat were found significantly in the Nurses' Health Study, which looked at 72,000 women, so large numbers of women. They found that those who ate even a single portion of red meat were significantly higher risk of developing endometriosis, which is a condition where the lining of the uterus, similar to the lining of the uterus, sticks itself outside. Now you have a genetic link, so mothers and daughters may have these conditions, just like polycystic ovary syndrome. But then, if your environment is such that it promotes the growth of the endometrial tissue, then making some changes can help, while you're having surgery or medication, can help to improve clinical symptoms as well. So eating green leafy vegetables and citrus fruits have been found to be specifically helpful. Seaweed and soy have been found to be particularly helpful in endometriosis. Fibroids, on the other hand, are these benign growths that can actually cause heavy periods and bloating and fertility issues. Again, we know that those who drink alcohol have a higher risk of fibroids, especially beer. Those who have fish and have been found to have an increased risk of fibroids, especially in a study done in Black women in America. We also know that if you're carrying excess weight, you have a higher chance of developing fibroids. So, there are lots of little things that one can do to improve. You can't help the genetic card that you've been dealt with. I had very early menopause. So there's nothing I could do about that. But what I can do is make some changes, because which will allow me, at this stage, I'm nearly 62, and I feel really energetic and healthy and vibrant. And so it's important to know that you can actually make a lot of changes without being too hard on yourself. And mushrooms are another one which we haven't talked much about. But mushrooms are not really a vegetable. They are a fungus, but they have been shown to, even a single mushroom, even the ordinary chestnut mushroom or a button mushroom, has been shown to reduce the risk of breast cancer, even a single one every single day, not raw, you want to cook your mushrooms. Similarly, herbs and spices. No dish that you eat should go by without having either cinnamon on it or some lovely herbs, basil and parsley and dill, because these are very high in antioxidant. They're very high in anti-inflammatory components that will reduce the inflammation in the body. Because remember, inflammation is the building block for all chronic diseases. And so you want to try and reduce that inflammation. That is why barbecued chicken and barbecued foods and fried foods and cereals and things like that are not so great, because they increase those advanced glycation end products and they make menopausal hot flashes much worse. So, trying to replace those sort of foods, if you love cheese and you can't give up cheese at all, then try to replace all the other things that you eat in dairy, which have got dairy, with soy products. And don't be under the illusion that it's genetically modified, that's why I shouldn't be having it. Actually, soy is one of the healthiest foods that you can put in your mouth. And so you want to, if you're going to look at the plant-based milks and things, soy wins hands down, both from the environment side of things as well as a health side of things. So oat milk, almond milk, these are all fine, but they don't really have the nutrition. So you want to choose things like pea milk or hemp milk, but rice, almond milk, and things do not have much nutrition. So it's okay occasionally, but it's not something that you should. It's better than dairy, but it's not something that I would choose.
Right, adding more nutrients to your plate
You
through
always
or
want
like
to,
your
because you
beverages.
eat 3 or 4 pounds worth of food every single day. So every time you eat an egg omelette, you're missing the chance of eating a tofu scramble. Every time you eat a donut, you're missing the chance of eating a big bowl of mango with blueberries and dark chocolate on it. So it's not that, you can't eat a donut or you can't, eat that pizza. It's just that if you do it every single day, you're missing out on the nutrients that you want to put in your body. That's the
Right.
important thing.
Yeah, thank you. I feel like I just want to snapshot that whole entire answer and put it into a blog and share it with the world around soy, because you
I
debunk
have a whole
soy.
fact sheet, Nichole. I have a whole fact sheet on the role of soy for women and men on my website that people can download. They can scratch out my name. They can share it with everybody. It's not a problem at all. I have a
Thank
whole
you.
chapter in our book as well, because I'm not paid by the soy industry, by the way. Okay, I'm not paid by anybody. But I just know the science behind it. And it's important to understand the science. You shouldn't believe it just because Dr. Bajekal says it, just because somebody else, some other influencer says it. It's important to actually understand that, there has to be scientific evidence whenever you're recommending any medication, any form of treatment, any supplement as well. People take a lot of supplements, collagen supplements. I have patients that come with 15, 20 different supplements in menopause and perimenopause, most of which are useless, most of which have never been proven. And what happens is they're spending hundreds of dollars on those medications. So it's B12 that you need vitamin D, possibly some omega-3 along with your walnuts and chia seeds. That's what you need. You don't need anything else. You really don't need anything else.
Yeah, those are the three biggies that we usually recommend too. And yeah, you get so much from a whole food plant-based diet. Just all the phytoestrogens that you mentioned. I actually have a follow-up question to that. What are your recommendations, if any, and thoughts on phytoestrogens in somebody who has hypothyroidism?
No problem at all. So what you have to understand is that soy, especially, can compete for the same receptors that thyroxine can. So when you take thyroxine because you have a thyroid disorder, if you're having a big glass of soy milk and taking your thyroid medication at the same time, they will both compete for the receptors in your thyroid. So that is why what one says is that ideally you want to take a thyroid medication on a fasted state a couple of hours before you actually eat anything. And if you are having soy for breakfast or whatever, try to give an hour and a half or between an hour and 2 hours so that you're not having that issue. But it's not a contraindication at all. There's absolutely no reason. There are plenty of studies to show that. The other thing I forgot to mention in pregnancy was when we talked about the prenatals is that folic acid is really important, and that nobody should be doing the natural way of trying to get folic acid just from green leafy vegetables or doing the other, we're not talking about the MTHR forms of folic acid, but really you want to take the standard folic acid, because having a neural tube defect, which is a defect in the spine in a baby, is absolutely avoidable, preventable. It's been shown. So you really want to make sure that you're taking the right prenatal as well.
Thank you for mentioning that. Yes, because I know a lot of times we always emphasize
Yeah.
folate from natural sources, but during pregnancy, it's very different. The needs are
Yes,
so much
absolutely.
higher.
And you also, if you are diabetic or if you have PCOS or if you have other conditions, you need to take a higher dose of a 5 milligram of folic acid as well. So it's important to, make sure that you talk to a qualified health professional, because pregnancy is a big deal, and, we're not in that business anymore generally of having 10, 12 children. So if you are somebody who is going to have a pregnancy, you want to try and make sure that you're as prepared as possible for it if you have the luxury of that situation.
Right. Yeah. Thank you. One more question around menopause. Do you have any lifestyle recommendations aside from diet that may help to mitigate some of the stress that we feel during this transitional time?
Absolutely. So one of the biggest reasons, biggest concerns that women have is weight gain. And so with weight gain, and that can cause, so stress itself can cause weight gain, but also hot flashes and keeping awake at night with night sweats, restless leg syndrome, all these things, stress and anxiety, which we know comes as the hormone levels fluctuate, can all lead to increased risk of weight gain from a number of reasons, just from the hormone levels changing, but also tendency to eat the foods because you are often comfort eating in that situation. You also may be at a situation where you have an empty nest syndrome, or you're looking after parents, or you have more money, so you go out more often and you drink alcohol more often. So it is important to look, because all these things can add to your stress. So it's not that we can avoid stress, but you need to be able to identify it and say, okay, so I'm going to take 5 minutes longer in the car and do some deep breaths before I get out into work. Or I'm going to go for a walk at lunchtime, even if it's raining, with an umbrella, and walk for 10, 15 minutes and get some fresh air rather than just eating at my desk. So these are important things to try and help reduce stress levels, because stress levels can really rise around this sort of age group between 45 and 55. And of course, if you are somebody whose periods stop under the age of 40, then you have a whole different situation where all your peers are having, no issues at all, and or issues of different kinds. Well, you are somebody who's, because I know in the US, they often call it midlife, right? Menopause is often, well, I strongly object to that simply because there are a lot of people, who do have early menopause and premature
Right.
ovarian insufficiency. So, what is midlife? I don't know. I feel I'm in midlife. I'm 60 and I'm hoping to live till I'm 120. So,
Right. It's so
so
relative to where you
yeah, it's very
are.
relative.
Right.
It's very, very relative. So stress is important to address. Strength training is another one that we haven't talked much about, but exercise. So
Mm.
walking is really important, but it's not enough to protect your bones. So to protect your bones, a whole food plant-based diet with soy is especially important, but making sure that you get enough protein. So in our new book, my daughter Rohini, who's a nutritionist, has written a chapter on protein, and my husband, who's a back specialist and a spinal surgeon, has written about bone health, because these are very important considerations in menopause. So you do need to focus on, good sources of protein, and plant protein are particularly healthy. You don't have to worry about food combining and all those sort of things. But, you are somebody who might need, if you're that you might need some protein powders, for example, some plant protein powders, simply because if you don't have a big appetite, then you're going to end up, not eating enough calories and not getting enough protein in that way. And
Right.
strength training is really important. So using your own body for exercises, so Pilates and yoga and things like that, but also doing weights is really important to keep your muscles from wasting away, because once the muscles waste, the bones don't have the support, and then you can fall, and hip fractures are responsible for a third of women dying as they get older. So you want to reduce that risk as well. So strength training twice a week, walking, and trying to exercise 1 hour a week, 1 hour a day is really something that I would encourage everybody. Climb the stairs. If you are sitting at a desk job, try and put an alarm, and every half an hour, get up, go for a walk, do some stretches, or do some squats, and then get back onto your desk. So that's how I would suggest, because
Mm.
you have to fit it around your lifestyle. You can't just have time to go to the gym. You don't have to do that. There are so
Right.
many, with COVID especially, we've all been able to access online 10-minute videos and things. So it's just learning to do that. And maybe buddying up also helps. If you have a friend that you can actually go for a walk or for an exercise class or swimming or whatever, it can make a big difference. But strength training is something that is very high on my priority list for women in the perimenopause and menopause. Really important. Helps also
Mm.
with insulin sensitivity and helps to reduce the risk of type 2 diabetes. And dementia in the UK now is a top killer for women. So again, a
Wow.
colorful whole food plant-based diet with lots of fresh fruit, and what you want to also avoid is important. So you were trying to reduce and avoid ultra processed foods, candies and sweets. You want to try and avoid fruit juices and shop bought cereals and animal foods, the derived foods. You want to really keep those unnecessary oils. You want to have cold pressed extra virgin olive oil if you want to have some oil, unless you have a weight issue, in which case you should try and reduce oils at least while you're trying to lose weight, and focus more on healthy whole fats, avocados and nuts and seeds and tofu.
Yeah.
So it's important to just understand that there's no one diet that fixes everything, in the sense that there's no separate diet for separate conditions. That's what I'm trying to say. So
Mm.
it's the same diet that will help you reduce your risk of dementia, will help you with your menopausal symptoms, and there are 34 menopausal symptoms that have been described. So there are a lot of symptoms. And you might be lucky enough not to have any. Women in Hong Kong and Singapore hardly have any hot flashes, while 8 out of 10 women in the US will have suffer quite significantly from hot flashes. So
Mm.
you want to be trying to make those little changes of bringing things into your foods into your life and lifestyle changes, so that you can deal with these symptoms as they come, but also be aware that for a lot of women, hormone replacement therapy is the right thing as well, and it can give you a lot of support for those few years. But lifestyle has to still go hand in hand. It's not one or the other again. So it's just
Yeah.
important to understand that.
Thank you. Yeah, I can share just quickly my own experience. I have no idea what I would have experienced if I wasn't eating plant-based, but I
Yeah,
do feel that I've been drinking soy milk for years
yeah,
prior to knowing the benefits, even, everything that's out now around
yeah.
perimenopause and menopause. And I do feel like that's how, like, maybe it's that, I don't know, but I'm not experiencing hot flashes. So I like to think that it's the phytoestrogen content
Yes.
in my
And it
diet. And I
probably
also,
is, from the studies that we've done and that have been shown. We do know. And also, don't forget, life expectancy now in Hong Kong and Singapore, for example, is like 88 years. In the UK, it's 83. I think in the US, it's slightly lower, but it's still another 30 years after you stop your periods that you have a very good quality life in the menopause or postmenopause. So that's why it's so important to look after yourself. And some women will continue having many of these menopausal hot flashes and all. Even most women will be done and dusted in 2 to 4 years, but for some women it will drag on as well. And then you have the later onset of complications such as osteoporosis and heart disease and dry skin and dry vaginas and things like that. So we do know foods like soya and watermelon have been shown to be vaginal lubricants. So you want to be really eating foods that nourish you rather than hinder your health. And so every time you look at a food, you think, is this bringing me health or is it bringing me ill health? And so when you do that, you can, rather than thinking it's bad for me or it's good for me, you just think, okay, I'm going to enjoy this pizza and I'm going to enjoy it now, and that's absolutely fine. But
right.
the vast majority of time, I want to be focusing on foods that will nourish me so that I don't spend, the last few years of my life in a hospice, not recognizing my loved ones and things like that.
Right. Yeah. I love the way you frame that. When you see a food, it's not good or bad. It's just, how is this going to make me feel
Yeah.
after I eat it? Is it nourishing me or is it not nourishing me? And that's such a good way to approach the food
Yeah,
on
it's
your plate.
always important to be kind. As I said, as women, we have a very hard time, centuries of being told that you're not good enough. And so you're always trying to be, something else. So instead of that, just learning to be kind to yourself and just talking to yourself as if you would to somebody that you love dearly. If you wouldn't say that to your best friend or to your daughter or your mother, Don't say it to yourself.
Right. Yeah, that self-love is so hard sometimes, but we really
Yeah.
all need to practice it.
Yeah.
Yes. And one last thing, I just want to put a plug in for the weightlifting. And I love that you mentioned that. It's so important. And I just recently read a study that looking at like cognition during menopause and saying that weight training is really showing to have a benefit with mood. Um, and I started doing it like I was doing more yoga and started weight training. And I do feel like even the immediate effects after and it's like what you said, exactly what you mentioned. I'm not a gym person. You don't have to be a gym person, but we go
No,
to
I
the
don't.
park. I do push-ups and
Correct.
squats, and it doesn't have to be complicated. You know, you
No.
can just do things by your desk, like you
Yeah, you can
mentioned.
just do some crunches or some squats, and there is no reason to for everybody to go and pound things in the gym. Yes, it's great if you can have a personal trainer for a few sessions, just so that you learn how to lift weights safely and things like that. That's great, but it is not necessary. Not everybody can afford that, but everybody can afford to use their own body as strength training and resistance exercises.
Right. Yeah. Thank you for adding that. So, okay, moving on to cancer. We spoke so you have unpacked so much in this conversation. So thank you. Did you want to add anything else? I know you just mentioned that, you know, it's one diet, whole food, plant-based eating can help with so
Yeah,
many things. Can you
yeah,
speak to the hormone
yes.
related cancers?
So we know that 1 in 7 women in the US, 1 in 7 women in the UK, and 1 in 8 women in the US will get a diagnosis of breast cancer in their lifetime. And so we know that there's about 5 to 10% of women who will have a genetically linked type of breast cancer. But even for them, eating a whole food plant-based diet has huge benefits. And the benefits come from the fiber, they come from the phytoestrogens, they come from the plant-based protein, all the antioxidants that are there. So we do know that, so for example, for women who are carrying excess weight and have polycystic ovary syndrome, they are 4 times more likely to have endometrial cancer or uterine cancer. So you want to make sure that, you are being protected from that, whether it's with the help of hormonal medications such as the Mirena coil and things, but also your diet is really important, because remember what I said, the excess body fat contains a lot of estrogen, which is also what is found in meat and things. So the mammalian estrogen is what stimulates these estrogen-fueled cancers. So whether it's endometrial cancer or breast cancer. So really, we know that trying to be a healthy body weight is important. It is important also to be that healthy body weight with the help of calorie light but nutrient dense foods, and those are whole food plant-based foods. So you want to be focusing on that. But specifically, for example, for breast cancer, we know that studies have been done with soy. They have been done with even women on tamoxifen with the diagnosis of breast cancer. Those who ate more soy, they were 30%, had a 30% reduction in dying from recurrence of breast cancer. So that's huge. And so it's important to know that you want to be incorporating things like mushrooms and green tea and flaxseed and soy in a whole food plant-based diet to keep your cancer risks to a minimum. And if you have breast cancer, there's no reason why you should avoid soy at all. And if you have thyroid conditions, you want to give a couple of hours gap between eating soy and your thyroid medication. So those are important things. Ovarian cancer also has been shown that, with saturated fat and with increased body weight, there is a higher risk. But it's a very difficult cancer to diagnose. So again, really important that the same diet that we talked about for menopause, you want to be trying to bring that in to reduce all the risks for whether it's bowel cancer, colorectal, whether it's liver cancer, whether it's and uterine cancer, ovarian cancer. And for cervical cancer, you must keep your smear tests. I know in the US you have smears every year. We don't do that in the UK because there's no medical evidence. So we would do it every 3 years,
Interesting.
and you have to have, rather than the smear test, the pap smear, what we do is the human papilloma virus. It's the HPV virus that is tested for, because it's a certain group of viruses. It's a sexually transmitted infection. Cervical cancer is caused by a virus. So that's why it's important to, test that. And then if there's a problem, then you follow up people more often. So in the UK, we have every 3 years from the ages of 25 to 50. After that is every 5 years until 65, unless, of course, there's a problem, in which case then the protocol is different.
Interesting. Okay. That's very interesting. Thank you for sharing that.
Yeah, and mammograms are every 3 years, but being breast aware and knowing how to examine your own breasts and knowing your breasts are really important. And the time to examine your breasts, if you're having periods, is to examine your breasts with the flat of your hand. Maybe look at a YouTube video as to how to examine your breasts, but it's best done just after a period so that your breasts are the quietest.
Okay, thank you. I know, do you have time to answer a couple of questions from our members?
Let's go for it.
Thank you so much. So they will very much appreciate that. So, okay, let's dive into this. Marlene says that she would like to ask you about medication. How would her doctor know how to get her off medication? So what happens to the medication? Is it a gradual reduction?
Therapy?
I'm wondering, she doesn't specify. I'm looking at the question. It says, is it a gradual reduction or once the blood work is an acceptable level? Is it immediate? It sounds like it might be hormone replacement therapy.
So if somebody's on hormone replacement therapy and they wish to come off it, so we usually advise women to be on menopause hormonal therapy anywhere between 2 to 5 years. But in my experience, most women who go onto it and find benefits never come off it. And I have 90-year-olds who are on HRT. But if you are trying to come off it, studies have shown it doesn't matter whether you wean yourself off or you suddenly stop. Your symptoms are not going to necessarily come back. But in my own experience of my patients, what I suggest is to slowly, if there is no urgency to stop, that means you've not been suddenly diagnosed with a cancer that is, hormonally sensitive, then I tend to tell my patients to wean themselves off over a period of 3 to 6 months so that they're not, and also ensuring at the same time that their diet and lifestyle, they're trying to improvise as much as they can. So that's what would be my advice for this person.
Thank you. Excellent advice.
I discussed this question in my fact sheets, I'm quite sure.
Okay, we've got it all there.
It's all
we
there.
will definitely include that link.
Listen to this.
Yeah. No, this has been wonderful. I know everyone will put this on replay, actually. Okay, Carolyn B says, so she gives a little bit of background, which is a really wonderful background. What she and her husband are doing, it sounds like making wonderful dietary changes and healthy lifestyle
Well done.
habits. So she says, I know there are many people who have problems keeping on weight. She eats a whole food plant-based diet, eggs occasionally, salmon, no dairy, and no gluten. And her husband eats what she cooks. And that has helped to bring both his and her cholesterol down to normal values, which is fantastic. But he started at a weight where he was already a little bit underweight. So now moving to a whole food plant-based diet, or mostly plant-based diet, he has lost even more weight, and he's very active. So she says that both he and she are very active. He does yoga every day. They have a nice garden, lots of fruit trees on their 3/4 of an acreage of land. So they're busy outside, which sounds like a wonderful lifestyle, but it can be hard for some people to keep weight on. And she just also says that she's 72 and her husband is 78, and she would like to know some healthy weight gain ideas from you.
So the first thing I would tell her is to get a Christmas or whatever present she wants of a personal trainer and actually do strength training. She needs to build muscle. Okay, so at 70, you want to be building muscle. That is so important for bones and for, preventing falls and things like that. So if you're already underweight, you have a higher risk as on plant-based diets, and for women, especially, of fractures. So really, strength training is key, really important. Then I would ask her to focus on foods that will actually contain healthy fats. So things like tofu is really important. Having a large handful of nuts and seeds are really important every single day. Having maybe half an avocado every day. These are important things to bring in the healthy fats so that she can start putting on weight. And also sometimes having cheat meats and things like that are absolutely fine because they are good sources of protein and will also help to satiate, and especially for somebody who's struggling to keep weight on, I
Mm.
would be suggesting that. And maybe working with a good dietitian or a nutritionist can help as well, just because there are individual things that are difficult to discuss on a forum like
Right.
this.
Right. Sure. Thank you for that. Angela says, I am a 57-year-old female. I'm in good health, slim, active, with no chronic issues. Health has always been very important to me. You may have answered this actually. I struggle with night sweats, hot flashes, and fatigue. I'm taking hormone therapy. What does the research say about the role of diet and lifestyle with regard to these issues? So I know we talked about
Yeah,
this in detail. Do you have
yeah.
anything to add?
No, I just would say in this situation, focusing specifically on getting the soy in, 2 to 4 portions. I tend to have about 4 portions in a day. So it's just, really focusing on that, as well as all the other aspects of the lifestyle and strength training and things, because those things will also help to improve sleep. You see, when you
Hmm.
exercise, especially exercise outdoors, and you do some meditation and laugh with friends, all these things are helpful as well, because that will help with anxiety and all the things that can trigger hot flushes even worse. So it's great that she's on hormone replacement therapy, but if she does want to come off it at some point of time after she feels she's got the maximum benefits from it, then the diet and lifestyle should really have taken over by then.
Great. Thank you. Catherine says, thank you for your dedication to women's health from an innovative medicine approach. I'd love to ask a question on behalf of my daughter. She's in her early 30s and suffers from endometriosis. As far as I know, no one else in our extended family has ever had this problem. She's not a plant-based eater. Would you know any triggers that could cause this, or any plant-based solutions that could make her menses less painful? Thank you in advance for any help or advice you could share. With
Yeah.
gratitude, Katie. So again, we went into this, but anything else
Yes.
to add?
So, yes, it would be great if she can start inching towards a plant-based diet. So trying to bring in more fruits, more green leafy vegetables, because they have been medically shown to actually help with combat some of the symptoms. And we know that eating more plants helps to reduce the pain of painful periods. But with the diagnosis of endometriosis, it's so important that she sees the right expert. So because she might need surgery, she might need to consider fertility preserving options of egg freezing and other things. So it's really important that that is not doesn't fall by the wayside, but a diet that is rich in plants, rich in omega-3s. These things are really important to help manage her symptoms. And exercise can really help with painful periods as well. So we know that women who exercise at least 45 minutes 3 times a week were found to have less painful periods. So it's important. But endometriosis is very complex, and it's a special interest of mine, and so it's really important that all aspects are looked at, not just the diet and lifestyle. But diet and lifestyle are hugely important, but as is the medical side of things. It's not something that should be neglected, and it can run in families. So it's important to be aware of that.
Yeah, thank you. And just a quick question about the exercise. Does it matter if it's aerobic exercise with strength training, or a combination of
A
the
combination.
two would be helpful?
Always, everybody should be doing combination exercises. But we
Hmm.
know that when you do strength training, especially in conditions like PCOS and in menopause and things like that, it is particularly helpful. And also, when one exercises as a woman, I would strongly advise against fasted exercise. So you should have eaten something small, even, whether it's a banana or some peanut butter on a rice cake or something like that. Fasted exercises do tend to disturb the hormonal, milieu, the hormonal balance in our
Mm.
bodies when you're exercising. So doing intermittent fasting and then going and exercising, or fasting and then exercising, you don't get the maximum benefits. And as a woman, especially, because most of the studies have been done in men, and we are not many men.
Right, right. That's interesting. That's good to know. It's the first I heard of that, and it's very helpful advice. Last question is from Beverly. I would like to ask Dr. Bajekal about her opinion on strontium citrate for women unable to improve bone density after trying all the methods. And like mind like-minded experts recommend. I've read claims that strontium citrate does not have the risk of other forms of strontium and that it stimulates osteoblasts. What does the research say? My doctor is pushing Fosamax for femoral neck T-score of negative 2.3. Realizing you can't give medical advice, I would welcome your take on treating this condition.
Okay. So osteoporosis is not my area of interest, not my area of expertise. But what I would say is that, of course, we know a diet and exercise is very important. We've talked about, weights and strength training. That is really key, because you'd be surprised how many, especially if you're quite small built, it's important to get a weighted vest, ankle weights and wrist weights, because those things are important because you have to build bone. But if somebody has got proven osteoporosis already, you can still exercise, and you should exercise to build that bone. But the exact medications that one takes really is something that depends upon your individual doctors and the trust that you have. And I would suggest having a second opinion if you don't feel confident. But with regards to strontium, I did look it up, and we know from all the studies that I don't think there's enough evidence to definitely push it. But I would have a different opinion if was I an expert in osteoporosis, and I might say that for this particular person, they should be taking it. It should not be recommended by somebody who's not highly qualified and really expert in their field.
Mm-hmm.
Because sometimes all these medications are promoted, I know, by people who don't have the expertise, and people are just grasping at anything to help themselves, and so you're willing to believe a lot of things. But it is important. I've been doing my job for 40 years. There's very little I don't know in obstetrics and gynecology, and so I think one needs to find people like that. So osteoporosis is not something that gynecologists deal with here, so it wouldn't be my area. I can explain a lot.
No, that's a great recommendation, though, to seek out somebody who specializes in that area. Dr. Bajekal, you have gifted us a book in this conversation. So thank you so much. This has just been wonderful and so insightful. And I know our members in our community are just going to greatly appreciate all of your wisdom and experience. So thank you for sharing today.
You're welcome.
And taking the time.
I enjoyed it.
Thank you. We appreciate you.
Yes.
When it comes to cancer, Alzheimer's, diabetes, heart disease, and other chronic illness, what really matters isn't how many books you read, how many webinars you attend, or how much you know. What really matters at the end of the day is what you eat and how you live. The science has given us what we need to know. Now it's time for action. It's time to implement and optimize your healthy lifestyle. It's time to get results. It's time to say goodbye to confusion and hello to clarity. It's time to say goodbye to bad habits and hello to good ones. It's time to fall in love with foods that love you back. It's time to join a community that will support you in achieving your goals. It's time for Whole Life Club.